So as I think about what advice I would give to somebody who has faced a lung cancer diagnosis and has a lung cancer surgery coming up, I think of something that came from a book that I read a number of years ago by Jim Collins called Good to Great, where he references the Stockdale paradox. And the Stockdale paradox is really about facing the brutal facts of reality while having unwavering belief. And I find that to be very true in life in general. Many of us in life will face moments of adversity where we have an opportunity to face that adversity, learn something about ourselves that will make us stronger on the other side. So that the next time we are faced with something that is challenging, we've got that much more confidence in our ability to overcome whatever that may face us in our future life. With that being said, I did take that very seriously when I thought about what the brutal facts of reality were. I was facing a lung cancer diagnosis. I was facing surgery, and I was going to be facing a timetable of roughly 5 to 6 weeks post-surgery where I was not going to be able to do things on my own, which my entire life I've been a very self-reliant individual. So removing my ego during that time period and accepting that help from the people that were surrounding me was not easy at first, but I learned to accept that because I knew had I not, my recovery may have taken much longer or I may have experienced a setback. I also spent time with my medical team, my surgeon, and the other experts as part of that medical team, really gaining clarity on what I should expect leading up to surgery. What were the next steps? What was expected of me? What should I expect from them? What was actually going to be occurring during the surgery? And then also what the timeline looked like post-surgery so that I wasn't falling into the trap of creating my own expectations that may be not realistic. So I encourage you to partner with your medical team to really understand the steps that will be necessary leading up to surgery, what's going to take place during surgery, and then get a realistic expectation and timeline for what that recovery is going to look like for you personally, and be patient with that. Because the last thing you want to do is have a setback on your recovery because you were getting a little bit too eager to push your body to the next step before you were really ready. That's something I struggled with, and if I could go back and do it again, which I hope I don't have to, I would have a little bit more patience of myself on that recovery journey to not push it as much as I maybe did early on as I got home and started to get back to doing some regular exercise. With that said, I would also encourage those who are facing, have gone through surgery or are in that recovery stage to really accept the help from those around you. Your number one objective after surgery is to get your strength back, get healthy, to recover. And those folks around you are there to help you do so. So making sure you remove any ego that may be getting in the way of those helping you will only serve you better and well on that recovery timeline as you get back to being who you are and the best of who you are on the other side of that recovery journey. Another piece of advice that I would suggest as you are going through the journey of a lung cancer diagnosis leading up to and post surgery in your recovery is to leverage organizations like the Breath of Hope as a support system, to get involved, to show your support to those who may be experiencing something similar to you, maybe early on in the journey, or maybe many, many years post-surgery, to extend your hand, but also be a resource to them, somebody to talk to who can share their own personal journey, their own personal story, because it does bring you strength knowing that you are not alone in this fight and that you have something to give to others, and that others ultimately have something to offer to you as your journey continues post-surgery and post-diagnosis.